Hello. Good evening, Madam President, Board of Trustees, and Superintendent Jara. My name is Stephanie Patton. I'm a school psychologist in the Clark County School District, and I am president-elect of the Nevada Association of School Psychologists. This week is School Psychology Awareness Week, and I'd like to ask the school psychologists to stand up if they would. We are here to advocate for children in this district. I am here because our children are receiving inadequate psychological and mental health services. According to the 2019 State of Mental Health in America report, Nevada ranks last in regards to mental health. Rankings are based on two factors: prevalence of mental health illness and rates of care. Nevada ranks 51st out of 51. We also rank last when just considering youth rankings. You might be alarmed to learn that 1 in 5 children and youth will experience a mental health disorder. We know that approximately 80% of children with a mental health issue do not receive care. Those that do access care in schools. Further, students are more likely to ask for help if services are available at school. Did you realize that CCSD is currently short more than 30 school psychologist positions? Almost 40 schools do not have assigned school psychologists, but are instead provided coverage by those of us already working at incredibly high ratios. Senate Bill 89 from the 2019 legislative session requires Nevada school districts to create strategic plans to meet nationally recommended ratios for mental health providers in schools. That is 1 school psychologist for every 500 to 700 students. The Nevada Association of School Psychologists is committed to helping districts in Nevada create and implement these strategic plans, and we would like to help Clark County School District. I'm here to ask that you create a task force in CCSD to begin the work that SB 89 envisioned. I also ask that we have a seat at that table so we can work together to ensure our children receive the support they deserve. Thank you for your time.
Thank you. Allison Clark, and then Michael Rube, and then Vicki Kreidel.
My name is Allison Clark, and I've been a CCSD school psychologist for 25 years. And I'm here to tell you Clark County needs more school psychologists. When are we going to start prioritizing students' well-being as the primary intervention to school safety issues? There's too many barriers to mental health care for our students and not enough professionals trained to address the problem. Fortunately, there are very specialized personnel in our schools already in place who could lead comprehensive school safety teams, and that would be school psychologists. Unfortunately, we're spread so thin across 3 and 4 schools that our time and capabilities are wasted as a Band-Aid effect on hemorrhaging arteries, with about as much hope to change the status of school preparedness for actively identifying and solving problems for students with our current ratios. Despite the shortages, despite the overwhelming need, school psychologists are leading school-based teams in identifying and intervening on behalf of students with special needs, those in crisis, those heading towards crisis every single day. Many of our students come to school just to survive, not thrive. School psychs are trained in addressing social, emotional, behavioral development and health practices in schools. Shortages in school psychology is clearly a public hazard, and schools need more of our time and expertise. You're looking for solutions to school safety, yet here we are, completely overlooked and underestimated as to the impact we could have in schools with administrative power and low enough ratios to spearhead prevention in addition to supporting students with disabilities. School psychs in our districts are undersupported, overworked, and poorly utilized. You want safe schools, yet the workforce with the training and ability to make schools safer is not being supported. We can't hire more psychs at the current pay scale. Pay us on par with our peers in Northern Nevada. Put us on the administrative level just like Northern Nevada. It's only fair, and it's only in the best interests of our schools and students. Please help us help you. Thank you.
Thank you. Michael Rube, and then Michelle Nathan, and then Vicki Kreidel.
Good evening, Madam President, Board of Trustees, and Superintendent Jara. My name is Michael Ruby. I'm a school psychologist in the Clark County School District. The t-shirt I'm wearing is a visual representation of the chronic problem facing school psychologists in the Clark County School District. The shirt reads, "I am 1 school psychologist for 1,812 students. I am somewhat lucky in regard to the ratios of some of my colleagues you see around the room. as many of them are serving 3 times as many students as I am. These high ratios are the direct result of a profound and increasing shortage of school psychologists in the district. Unfortunately, as egregious as these ratios are, they don't even take into account the complicating issues that also affect schools and make the school psychologist job more difficult, such as ELL percentage, socioeconomic status, mental health concerns including suicide rate and risk factors, abject poverty, homelessness, and immigration status. School psychologist staffing shortages are not only critical, even our current levels are unsustainable without drastic changes, including the establishment of a competitive salary structure like other school districts in Nevada. In the 1947 classic Christmas movie, Miracle on 34th Street, a young Natalie Wood expressed her hopes in 3 immortal lines: I believe, I believe, I believe. I'm not asking for Santa Claus to pull off a Christmas miracle. I'm asking for the board to review the facts as presented by the Nevada Association of School Psychologists and use sound reason and judgment to solve the ever-increasing school psychologist staffing crisis. This shortage is so profound that a failure to act is inconceivable and unacceptable. I have faith that this board will continue to do what is right for our community, schools, parents, and most importantly, students. I believe, I believe, I believe. Thank you.
Thank you. Michelle Nathan, and then Vicki Kreidel, and then David Gomez.
Dear Madam President, Board of Trustees, and Superintendent Jara, my name is Michelle Nathan. I am a school psychologist. I am one school psychologist to over 2,000 students, currently covering 3 schools. Having 3 schools and a high ratio makes it impossible for me to effectively do my job. I am forced to spend many hours outside of the school day to make sure that I keep the district in compliance with special education timelines, laws, and procedures, and keep the district out of due process hearings. And it is still impossible for me to do my job. I am also unable to provide the students with mental health support they need. I am having to react to situations rather than be proactive to prevent the situations from occurring. Our children deserve our help, and we need to lower ratios to do it. Unfortunately, our department is unable to recruit and keep school psychologists, not because of our department, which is amazing and really supportive, but because of the lower pay compared to nearby districts, as well as the workload and what is expected of us. We need action now to increase the number of school psychologists in our school and to be able to provide the services our children need and deserve. And just FYI, there was another school shooting today in California, and we can help prevent those too. Thank you.
Thank you. Stephanie Patton is signed up on 4 items, so you actually get 10 minutes. You don't have to use it all, no pressure, but you can. And then David Gomez, same deal.
All right. Good evening, Board of Trustees, Superintendent Jara. For the record, my name is Stephanie Patton. As you know, I'm a school psychologist, and I'm here tonight to comment on a few consent agenda items. First, I do want to say thank you to Dr. Young and Dr. Jara for your comments about school psychologists, and we will be represented at the Council of Great City Schools as well, so we look forward to that. So I strongly recommend support for agenda item 4.03, requesting to purchase testing materials from Riverside Insights. As you may be aware, school psychologists are responsible for conducting evaluations to determine whether students are eligible for special education services. Without sufficient testing materials, we are unable to do our jobs. I would like to mention something many people do not know. School psychologists are trained to do so much more than evaluations. Unfortunately, critical shortages in CCSD makes it nearly impossible. I would like to share with you a few things we are qualified and trained to do and provide our schools here in Clark County. Promote student engagement and motivation, support schools with response to instruction and multi-tiered systems of support initiatives, conduct psychological and academic assessments, individualize instruction and interventions, manage student and classroom behavior, monitor student progress, collect and interpret student and classroom data, improve student communication and social skills, assess student emotional and behavioral needs, provide individual and group counseling, promote problem solving, anger management, and conflict resolution, reinforce positive coping skills and resilience, promote positive peer relationships and social problem solving, make referrals to help coordinate community services provided in schools. Assess diverse learning needs. Promote culturally responsive services to students and families from diverse backgrounds. Adjust classroom facilities and routines to improve student engagement and learning. Prevent bullying and other forms of violence. Support social-emotional learning. Complete functional behavioral assessments. Develop behavior intervention plans. Assess school climate and improve student connectedness. Implement and promote positive discipline and restorative justice. Implement school-wide positive behavioral supports. Identify at-risk students and school vulnerabilities. Provide crisis prevention and intervention services. Help families understand their child's learning and mental health needs. Assist families in navigating special education processes. Enhance staff understanding and responsiveness to diverse cultures and backgrounds. Help students transition between school and community learning environments, such as residential treatment or juvenile justice programs. Anyone working in schools may be shocked to hear that list. They may be thinking, wait, my school psychologist doesn't do all of those things, and they are correct. Those are all the things that we are equipped and trained to do when we're working at appropriate student ratios. These are the things the students and educators I work with are missing out on because I'm covering 3 schools and supporting 2,800 students. These are all the things the Clark County School District desperately needs and things we cannot afford to go without, things our children deserve. So please help us improve our ratios. In regards to agenda item 4.14, I would like to speak about student expulsions. One of the incredible benefits of having mental health providers in schools is the ability to help promote positive discipline strategies. Research has proven that positive discipline strategies benefit all students for several reasons. Opportunities to forge relationships with caring adults coupled with engaging curriculum prevent discipline problems. Discipline that is fair, corrective, and includes therapeutic group relationship building activities with students reduces the likelihood of further problems. Strategies that effectively maintain appropriate social behavior make schools safer. Safer schools are more effective learning environments. Positive solutions address student needs, environmental conditions, teacher interactions, and matching students with curriculum. Reducing student alienation by encouraging peer relationships can dramatically reduce acting out in schools, especially in large settings. When students are given an appropriate education in a conducive environment, they improve behavior and performance. Appropriately implemented proactive behavior support systems can lead to dramatic improvements and have long-term effects on the lifestyle, functional communication skills, and problem behavior in individuals with disabilities or other kids at risk for negative adult outcomes. Providing positive and proactive supports in schools is clearly very important, but we cannot expect classroom teachers already overwhelmed with teaching duties to coordinate and implement these activities and services. School psychologists are trained to assist. If we were working closely with students and staff in one school, we could easily help build school-wide positive behavioral support systems and help train administration and teachers on positive disciplining practices. Unfortunately, this is currently impossible. In order to effect real change regarding discipline practices, implementation must be constant and consistent. The problem we face in CCSD is not that we aren't sure what to do, it's that we don't have the resources. I would like to make a comment on agenda item 4.25 regarding hiring of licensed personnel. I would like to point out that there are only 2 school psychologist names on that list, both of whom are returning to CCSD after retirement. This despite the more than 30 open positions. Recruiting school psychologists to our district is very difficult given our current salary schedule and caseload numbers. School psychologists are highly trained individuals. We have 7 years of schooling that includes a bachelor's degree and an education specialist degree, which is the equivalent of a master's plus 32 credits. We have all completed a practicum, a year-long internship, before we were licensed here in this work in schools. Despite all of this, the starting salary for a school psychologist in this district is less than $45,000. Our neighbors in Nye County start school psychologists at $58,000. Up north in Washoe County, the school psychologist salary starts higher than $80,000. Many school districts in Southern California pay their school psychologists as administrators. Some schools have 2 school psychologists there to ensure students are fully supported. I received my education at UNLV. Out of the 14 students in my cohort, only 2 of us remain in the Clark County School District. 2 weeks ago, this district lost a brand new school psychologist who had moved here from California to a local charter school where the pay is better and the caseload is less. 110. This is the number of evaluations currently on my caseload. This number does not include any initial referrals that I will receive from my school or parents from now until the end of the year. Here are a few more numbers I would like to share. 38. 38 is the number of schools in CCSD without an assigned school psychologist and currently receiving coverage. 163 is the number of school psychologists employed by CCSD. 156 psychologists are based in schools. Of those, 17 are working half-time. That is the equivalent of 147 and a half school psychologist positions. 2,233 is the average ratio of students to one school psychologist in this district. 500 to 700 is the national recommended ratio. 329,470 is the number of students in the Clark County School District. It is also the number of students in this district missing out on all of the comprehensive psychological supports and services that can be provided when working in acceptable ratios. 329,470 is the number of students who deserve better. Agenda item 4.28 is to select an architecture firm to replace heating, ventilation, and air conditioning components at Clifford Lawrence Junior High School. As someone who works at Lawrence Junior High School, I can attest to the fact that updating those systems is necessary. This is actually my 4th year working at Lawrence Junior High School, and the 4th year I've only been able to commit 2 days to that school. This despite there being more than 1,400 students enrolled, 5 self-contained special programs, and 3 completely full resource caseloads. Yesterday was a fairly typical day for me. I had an evaluation meeting that morning for a student who recently arrived to CCSD from another state. I had to reevaluate him in order to determine eligibility for services here in Nevada. I pulled 2 different students that morning for testing and ran a counseling group with a group of girls instead of eating lunch. I scheduled 2 parent conferences, then spoke to another parent who came to the school with concerns about her son's behavior. After work, I drove to another CCSD school to complete preschool child find evaluations. After several hours of evaluating 3 and 4-year-olds, I finally got home to have dinner with my own family. Shortly after dinner, I settled in to begin writing evaluation reports for 2 meetings I had today. I finally went to bed at 11:30 because I was too exhausted to continue working. I woke up this morning at 5:30 to finish the evaluation report for my meeting at 8:20 this morning. After that meeting, I worked on the report for my meeting at 11. By 12:30, I was finally having lunch, the first meal for me today. I then pulled a student for testing, called a parent to discuss concerns for her son, prepared paperwork to send home for a different student who is due for reevaluation, and observed a student during PE. Now I'm here. My 4-year-old son is sitting right here, waiting for the opportunity to engage with his mother. I'm here trying to convey to you the importance of my job, and I'm desperately trying to make you understand that this pace is not sustainable. I don't know how much you care, or if you think you can do anything to help me or us, but we just need you to know. We all work incredibly hard, and we're just too exhausted to push ourselves any further. Thank you for your time, and I hope to hear from you soon.
Trustee Cavazos?
Would we be able to get a copy of Dr. Patton's remarks?
Absolutely.
For everybody? Thank you.
Did you make her a doctor? Yeah. If you give that to Cindy, she will make some copies. Thank you. Is David Gomez still here too, or did he leave? Okay. Okay, with that, that's all we have signed up to speak on public comment. Trustee Garvey?
Thank you, Madam Chair. I'd like to make a motion to accept the consent agenda items 4.01 through 4.47.
Thank you. Trustee Young?
I second the motion. Like to make a quick comment.
Sure.
Thank you. That was very powerful and very accurate, by the way, and probably not as, I don't want to say not as powerful as it could be, but there's so much more to that. I think you toned it down a little bit. It's almost much more than that and totally overwhelming. So I know the trustees up here are very much supportive of what not only school psychologists, our social workers, our nurses, our related service people do, and you all are a team to make that happen in the schools. Just keep the thoughts and the comments coming. I do agree about a work task force to kind of do something with this. I do, nothing personal, Steve Augsburger, but I definitely feel that school psychologists do not need to be in the teacher's salary schedule. Really do not. I came from Colorado Springs, and we were not on the teacher salary schedule. We were in between the administrators and the teachers. And in Ohio, it was the same thing. And so, but we did have some leaning more toward the administrators' salary schedule because we were doing so much more. We've got to change that if we're going to be competitive. If we're going to be competitive nationally. And we need this profession to grow, and we need this profession to come into the Clark County School District. So those are just my comments. Thank you for your comments.
Okay, trustees, I have a motion by trustee Garvey, a second by trustee Young. Trustees, please cast your vote.